And today being Terrific Tuesday, then we got to handle matters health, because health is the greatest wealth that you can ever have. Na kama vile nilikuwa nimekuambia hapo awali, today we'll be having a guest here in the show, and she'll be able to be talking to us more about cancer. Remember, this season of October is the season of breast cancer awareness. You are well?
Thank you. I'm well, Gloria. And I'm happy to be here.
Wow.
For sure. Healthy is the greatest wealthy in us.
Yes, that you can ever have.
Yes. Thank you.
Now, please, first of all, introduce yourself, and as well, utuambie, as a cancer program coordinator, what is your role as well?
Thank you, GM Gal. Yes. I will start by greeting all our listeners in this 97.1 FM GGV. My name is Shirley Karambu, and by grace of God, I'm one of the health workers in Meru County that I'm proud of, and mostly or specifically working on coordination of cancers in Meru County. I'm honored to be here this afternoon to talk about this menace cancer that I believe, or we all know that it has affected our families, our individuals at a personal level, in our communities. For sure, GM girl, if I ask you to list the number of people that you know have died of cancer this year, 2025, the list will be long.
It will be.
And I'm happy this afternoon I'm here to answer 3 questions. And the fourth one, it will not be a question, but I'll be explaining why I'm here.
Okay.
These 3 questions is GM girl. If we post this recording and ask you to ask people to send questions, the first question I'm sure that will come is, what is cancer? And even the second question, it will be, what is cancer?
What is
and the third question, it will be, what is cancer? Because many people are confused about this disease, and that's why I call it menace, because we try to explain, but most of the time we are not able to convince people what is cancer, because we are also limited by this disease. Yes.
Wow.
Thank you very much.
Welcome. So we'll start from the basics, just like what you have told us. Many will ask, what is cancer? All right. Many will ask, what is cancer?
Yes.
So for somebody listening who is who might not be fully understanding, when we talk about cancer, what exactly are we talking about?
Yes. Thank you. I will explain in the simplest way that I can, and see cancer is a disease that occurs when our body cells grow or multiply uncontrollably. Normally, in our bodies, we have the system of these of these cells development, not really development, multiplication or the growth. The body has a system, and what happens is that when a DNA of this cell is affected, these cells start growing now at their own speed, which we call it uncontrolled speed. And since this body has a system, and this body did not request or did not demand for these cells, so when they grow in excess, the body does not have a place to take these cells. So they accumulate at the point of this at the point of where they are being multiplied. And before I go further, I want to say that the cancers, they are named after the part of the body they affect. GM girl, the only place that has not been in the only part in our body that is not affected by cancer is maybe the hair in our hand. What else? I don't know if the nails yes, something like that. So cancer is named after which part they have been affected. So if these cells start misbehaving at your ear or your mouth or your nose or your end. That is where these cells, they will accumulate and form a big mass that we call tumor. Tumor is a mass of these cells, these abnormal cells. And at times, this tumor becomes so big until it wants to sustain itself where it is. So it sends signal, chemical signal, that tells the body to form a blood circulation in that tumor. So this tumor starts sustaining itself. It will attract the nutritions that it needs, and then you find it growing every day at the expense of the body normal cells in our bodies. That is the maximum that I can talk about the cancer and what is cancer. And then I also want to say that not all cancers form tumor. We have cancers that does not form tumor. For example, the one that is common and is known is leukemia. This cancer affects the blood cells and the bone marrow. So this one does not form tumor, and also many others. Yes.
So breast cancer forms a tumor.
Breast cancer forms a tumor.
Okay. And what are the causes of cancer in general and as well as breast cancer?
Also, GM girl, I cannot point a single cause of cancer, but the cancer is caused by a combination of so many factors. One is the genetic factor, lifestyle factor, environmental exposures, infections like HPVs, we call it human papilloma virus, hepatitis virus, and we thank God these two. We have a vaccine that can prevent this, and also you have hormonal factors that mostly causes the breast and the prostate cancer. So we cannot say this is what causes cancer, because even the research that has been done, they are usually limited. We believe that this might have been one of the causes, but I cannot tell you, yes, it is genetic. I cannot tell you it is hormonal. I cannot tell you somebody was exposed somewhere and got the cancer. No, we don't have a specific cause of cancer that one can stand with it and say this is what causes cancer. Yes.
And how serious is cancer situation in Meru generally, since you are a cancer program coordinator in Meru?
GM girl, allow me today to mostly speak about breast cancer, because this is the month of October where we commemorate this breast cancer. But what I would like to say is that we have had many people say that we are leading in cancer. This one I'll not tell you yes, I'll not tell you no, but I'll be coming to this media house after this month when the NCI, National Cancer Institute, will release the data for cancers in Meru. But today I'm talking about the leading cancer in female, breast cancer. And that what has brought me to this media house today. It is the leading cancer in female, followed by stomach and the cervical. And I want to say this in this media that most of us and most people think that cervical cancer is the leading cancer. It leans in the number of death. But when you come to the cases, it is much lower than the breast cancer. Not only in Meru, nationally. Breast cancer is leading in female, both in Meru and in Kenya as a whole. But as I've said, I'm becoming back to this media house when we get the release of that report from NCI, because what they are doing now, they have developed a system that is capturing every cancer patient from the facility where you seek the treatment, and then they are able to link you with your home county. So even people who have been treated outside Meru County, after this October, we will be able to know we have 10 people, 100 people went to KU, went to Kenyatta, went to Eldoret, wherever they were seen. You'll be able to see so and so went to Eldoret, he was treated on this cancer, and this person was from Meru. But at our cancer registry now, because we have the cancer registry, I wanted to say that from the time we started that cancer center, cancer registry, that is in 2020, we have earned over 4,000 cases. And these 4,000 cases, GM girl, is not from Meru County only. We serve our neighboring counties, Tharaka Nithi, Isiolo, Marsabit. So you cannot say this 4,000 is from Meru County alone. Secondly, these 4,000 are not all the active cases. The challenge we have is the lost to follow. Lost to follow is where you are seen in Meru once, twice, thrice. The fourth time, we don't see you. We don't know if you have rested. We don't know if you have gone to another facility. So we cannot say that actually out of these 4,000, around slightly above, 4,000, slightly above 2,000 are the active cases in Meru County. But out of these 4,000 cases, we have over 600 cases that are breast cancer. And also in this breast cancer, not all of them that are active. Also around 400 are active breast cancers in our cancer registry. And I'm talking of 2000 to 2020 to 2025. So that's a big duration. We have lost quite a number in between. And this is only cancer registry Meru, but we have other facilities, around 6 other facilities that treat cancer in Meru. We don't have their data, and as I've seen, you soon be having their data. The next time I come here, I'll be able to tell you this is what we have in cancer registry, MTRH, or our referral level 6 hospital, and this is what we have in other facilities within Meru County that is treating cancer, and these are the number that have gone outside Meru for treatment. I'm here today to bring the awareness about cancer. This is done globally. It is not only in Kenya or in Meru, and it has been done for the last 40 years. And usually what we do in this month of October, usually the month of October, the breast cancer is associated or it's identified with a pink ribbon. If you go and look at the cancers, mostly even if you Google, you find that cancer is pink. Others have their colors, but I know the general for cancers is your color here, purple. Yes,
gold,
when you see purple and the cancer, is talking about all the cancers, but pink is specifically for breast cancer. And this month of pink, October, usually this pink is identified with the hope, with the strength, and with the strength to fight the cancer. But usually what we do in this month, we bring education to the people, the communities. We create awareness about this breast cancer. We promote screening, and then we also encourage the survivors. We just encourage them, talk to them well, and also give them the love of Christ that we are given now free. And then we also remember those whom we have left through this breast cancer. As I started saying, if I ask you if you know anybody who has died of cancer, specifically breast cancer, I'm sure when you hear around the October and breast cancer, there is somebody who come in your mind. So and so died of cancer, yes, you remember that person. And then I've talked about mostly the screening. I want to say that in our facilities, we thank God that Meru County, we have many facilities. I don't think there's somebody who walk for kilometers and kilometers going for service. We have 216 health facilities in this county. And what I'm proud of is that all these 216 GM girl, if you walk to any of them and tell them, I want to be examined breast, there is nobody who will not do that. It is an examination that can be done by all our health facilities, by all our health workers. And actually ningependa ku emphasize on this na niseme hata kama ni kusema na lugha ya Kiswahili ili kila mtu anielewe. Katika kaunti yetu ya Meru tuko na hospitali, hiyo ndio health facilities, tuko na hospitali 216. Na sote hizi facilities sote zetu zote zinapima ugonjwa wa saratani. And even if they test you na waone kama you are at an advanced level that they cannot handle there, we have the referral system that they tell you want to send you so and so this facility or this facility and you will be taken care of. Hiyo ndio furaha yetu ya kusema ya kwamba facilities zetu sote they are open. We thank the government county of Meru because all these facilities they are open 24/7 working for the people or for the community of Meru. So I want to talk about the screening specifically. We have 4 types of ways of screening. Number 1 is self-examination. You are told, GM girl, you are told, stand in your mirror once a month. Look at your breast, how it look like, and see if there's a change you are seeing. Wewe mwenyewe iangalie tu na macho, look at it and see if there's a change you are able to identify. Then you are told to examine it. Kuexamine ni ifinye kona zote na uone kama kuna kitu na feel uko ndani. That is what we call self-examination. Na ukienda kwa these facilities, they also even show you, they will demonstrate to you how to do it. Number 2 is what we call clinical breast examination. This is done by an health worker at the facility that I've talked about. The health worker that you meet there, the clinician you meet there, the nurse you meet there, if you go and say I want to be examined by breast, they will do it. And these services are free for your information, GM girl. And the third one is where we do breast x-ray kwa lugha ya kueleweka, but as the medical lugha we call it mammogram. Mammogram is done, we have mammogram, and then the last one we have ultrasound. And all these are done in most of our facilities. If you come here to our level 6 hospital that we have upgraded to level 6, you get the ultrasound, you get the mammogram. But what I've come to tell our people today, before even you come to level 5, Meru Teaching and Referral Hospital, go to the nearest facility this month and ask the health worker that you meet there, you want to be examined for your breast. That's what I've come to preach today.
Okay.
And then, because we have talked of self-examination, I want to give at least 5. I know there are many, there are more. 5 signs of breast cancer, or 5 things that if you find yourself having any of them, rush to the hospital the same day.
Okay.
Number 1 is the lump in the breast. Lump ni uvimbe. You feel that there is something that you are feeling from your breast that has not been there before. It can be one, it can be both. Rush to the nearest hospital. Number 2 is unexplained pain. You are feeling pain that was not there before, and this pain you cannot associate it with anything. It has just come. That's not a good sign also. We urge our community, our people to go to the hospital. And the third one, a change of the breast, change of either size or shape. Or the other change is when you see the nipple is inverted, or it looks as if it is going inward. Inaingia ndani kwa Kiswahili. That's also not a good sign. And the other one is the skin change. Unaweza ona your breast, it has changed the color, some part or the whole of it. It has turned reddish. Go to the hospital. And then if you press your nipple and see that there is something that is coming out, blood stain, it look like blood, or even very clear water, either from one of your breast or both. That is not a good sign, and we urge our people, when you get that sign, please rush to the nearest hospital. Yes, those are the signs that I can talk about today, but I know there could be more than that, because this list is not limited.
It is not limited.
Yes, yes.
Okay, since you have told us about signs and symptoms and also promoting screening,
Yes.
what are the preventions? What are the preventions that I'm supposed to do to ensure that I don't have this breast cancer or any kind of cancer?
Thank you very much. Let me answer this question by starting to give the risk factors that we associate, or the few studies that have been done. I've mentioned them and said this could be one of the causes of breast cancer. And number one, when we talk of this risk, we usually like dividing them into two parts. We say these are things that we can do nothing about them. They are naturally there. And then these are the ones that we can modify. And that's where we go now to the prevention. So let me start with the ones that we can do nothing. GM girl, you can change nothing for you to be the other gender, because you are born a girl, a female, just like me. So just being a female yourself is a risk of having breast cancer. The other one is about age. We grow every day, every minute. We are entering minutes, hours, weeks, days, years. So we are told those people who are above 40 years, they are at more risk than the younger people. Yes. And number 3 is family history. And when I talk family history, I like telling people I'm not saying this disease is inherited. No, but we talk of family history of having breast. Let's say you had a breast of cancer of one breast. Maybe you recovered, and then we are told you stand a bigger risk of having a breast again, maybe the next breast or the same in future. That is one of another risk. Or you are having relatives who have developed this breast cancer in your family. Your mother, your sister, your cousins, your aunt. Maybe they might have had this breast cancer. And by the way, I'm talking of female more, but I want to put it very clear here that even men, even male, they get breast cancer. It's only that it's very minimum, below 1%. But they also get breast cancer, and the signs and the symptoms are the same like as the ones you have seen. Then we are also told those people who get the onset of menstruation very early, below 12 years, and those who get to menopause very late after 55 years, we are told they also get breast cancer more frequent than others. And lastly, I want now to say the modifiable factors that you can modify or we can do to prevent this. One is the obesity. It is said that those people who are very, what do you call it? People with many big, they call it big bodies. Okay, they are big-bodied people. Yeah. They are more exposed to breast cancer than others. Those people take a lot of alcohol. Those people smoke tobacco, cigarette, they are also more exposed than others. And those people don't mind about the diet. We are also told poor diet can cause this type of cancer. And the last one, also people don't do any exercise. We are told they are at. Why are you laughing? You are one of them. No, you look as if you do a lot of exercises. So when we talk about that is now when you are able. When I'm able to answer now your question on the prevention. We only prevent the modifiable factors. Right. Those who are very big, we tell them try and cut your weight a bit because we don't want you to expose to this. Those who smoke, as long as we preach the word of God to them to be saved and stop smoking and stop drinking a lot of alcohol, we also ask them, please stop this because it might expose you to breast cancer. Yes, and then when it comes to diet, you only advise people to take care of the diet with a lot of fruits, with a lot of vegetables. And then the last one that we usually ask people to do mostly, but we know it is almost done automatically. I forgot to say those people who don't breastfeed, they are also exposed to breast cancer for one reason or the other. And we also encourage these ladies to breastfeed as much as they can.
Those who don't exercise.
Yes.
Mtu wa exercise lakini anatembea sana, si hata ni exercise.
Kutembea ni exercise. Ndio nimesema umecheka because unajua unatembea. Yeah, kutembea. So kutembea ni exercise pia.
Okay. It's a misconception.
Misconception about cancer or the myth about cancer. Even if you ask you one, you give me one. Because we know them and we have learned them. But as the pastor has said, hakuna magonjwa yako na hakuna magonjwa yetu, hakuna magonjwa ya familia yetu. Because we believe in the healing of Jesus Christ. That's one thing I could like to say here. Because I'm a Christian and I'm born again Christian. I believe all diseases can be healed. But the question about misconception, there are some people who say cancers is for the older people, and I've come here to say that is not true. Cancer can get anybody. We have young, we have old, we have male, we have female. Cancer can get anybody. Number two, we have people who say that cancer is a death sentence. That today I've come here to say no. Cancer can be healed. We have very good survival rate, and mostly from breast cancer, which is above 80%. 80% of the patient are getting a good survival rate from breast cancer. I'm calling it survival rate because GM, we don't have a boundary where we can say so and so is healed, because we like doctors like monitoring this patient. And when you come to the hospital and you are told, come next year, that's a good sign for this disease, because the doctors looked at you and seen that there is nothing active in your body. So, cancer is not a death sentence, as many people may have thought about. There are others, and actually this one is very, very, very common with many people who says, afadhali kama ikuguswa, kwa sababu wakati aliguswa ndio iliharibika zaidi. Hata wewe huyu umesikia GM, nimeona vile umefurahi. So this is not true. When the drugs that are given to treat cancer, when they start fighting with these cells, usually people see the side effect of this drug as if it is worsening the patient. But the truth is, the drugs are working. It is better when they are getting treated than when you tell somebody sleep there, kwa sababu hii kiguswa inaweza kukuua haraka sana. That is not true. And then actually sana when it comes to those who undergo operation, the surgery, they say iliguswa ikalipuka. I think you must get your statement. Iliguswa ikalipuka. But that is not true. Treatment is working and the people are getting healed. And then the others you say, hii ugonjwa ni yetu. Na nimesikia pastor akihubiri akisema hakuna ugonjwa yenu. There is no family that is identified with the cancer. Cancer is not inherited. So we cannot keep we cannot say that this disease come from this family. It is not. And the last one, I know there are many, because misconceptions are many. There are those who believe that herbal and traditional medicine work better than these conventional drugs we have. That is not true also. It has not been confirmed. No research that has been done to say that this drug work better than this herbal drug work better than the drug that we have in our hospitals. So one of the big challenges we experience, and mostly here in Meru, is lack of enough data to really say this is where we are with the cancer, this is what is happening, these areas, this cancer, and we believe this is the cause. We don't have enough data, we don't have enough research in Meru, and actually in this media, as I sit here today, I could like to call upon the NCI, the National Cancer Institute, to come to Meru and do more research on cancers here. And the second one is what we have talked about, the misconceptions. We have people who are coming to the hospital very late because they believe when I am told I'm being suspected for cancer, they rush to the herbal, they rush to the traditional doctors, and when they come to the hospital, they come very late in stage 3, very late in stage 4. And GM, let me tell you, there's nothing as frustrating as a clinician or a doctor receiving a patient who has never gone to any hospital. When I said we have 216 health facilities in this county, and here you are receiving a patient at stage 4 with breast cancer or with any other cancer, simply because he was told drugs does not work, or he felt that sitaki iguswe, kwa sababu ikiguswa ina escalate. Exactly, the one is escalating. We really get frustrated. We are not happy. It's only that there is nothing we can do. And lastly, let me say the government is working very hard to fight this disease. From our governor, His Excellency Reverend Isaac Mutuma, is putting a lot of effort on this cancer. We have our CEC, our chief officer, our directors, all the workers. We are working very hard, and particularly this month, the awareness is done in every facility, in every community, because we are using all the community promoters who are in our villages to spread this message. Recently, you saw our governor launch the TC scan. This is a plus to the cancer department, because this TC scan will be used as diagnosis. And I want to say that level 4 or level 5 hospital, MTRH, it is well equipped to fight this disease. We have a functional histology department that is working 24/7. We have personnel. The government has invested on these personnel, and we are moving at a very high speed, because very soon we are having an inpatient ward that has never been there before for this patient. And this is because we have patients who come there for chemotherapy, and some of the chemotherapies take even 6 hours. And you can imagine a patient sitting on a chair for 6 hours waiting for this for this process. So we want to have an inpatient ward that is very soon, by the end of this year, most likely. I am not stamping this, but I know you'll be having a ward. In our cancer center also, we have a very working and a very effective registry cancer, which is a few in this country. Actually, registry cancers, there are very few, and Meru is one of them. And we are also planning, and these plans are at an advanced level, to have the laboratory and the pharmacy at the cancer center. Because if you know where our cancer center is, you walk a distance to access the facilities from the main hospital. And we imagine a patient who is very weak, walking from there, go to the lab, get a test, then come back, then go again, get the drug. We want, when our patient enter the cancer center, we want to see them walk out, going home, not going to any other department. And my last thing, GM, I want to give my parting note, and my parting point is only one. Early detection is equals to early treatment, which is equal to better outcome. To the doctors, to the clinicians, to the other workers, better outcome is what we work for. We want to see this patient strong, walk, and get healed. as our motto for this county is we say every day, screen today, live tomorrow. Unless you are detected early, we are not able to intervene early enough. So I sit here today, or I'm here today at GGV FM to announce to all our community, everybody, wherever you are, before the end of this October, before that, the 1st of October, please walk to the nearest health facility, get screened breast cancer, and any other concern you have. Our facilities are open. The government have invested on this. Please, let's do what is expected of us. And what is expected of us is to go to the hospital and get the services.
Okay.
Yes.
Asante sana. Thank you so much for availing yourself and coming to give us insight more about breast cancer, Madam Shari.
Thank you.
Oh, wow. That was Madam Shari.